What is your advice to a student or a resident who, kind of wants to get a lot better at being able to choose or to pick the right one rather than just giving a blanket medication like happens most cases?
This is our goal, to not let that happen. Yeah. I get the third-year students every rotation to talk to about proper use of antibiotics and working up fevers, because the goal is to try to find out what's the cause of the fever and pick out drugs that are suitable. And to do that, you have to assess the patient properly, which very often is not done. People just go in and run septic workup done, which means they ordered a couple of blood cultures without looking at the patient, and pick broad-spectrum antibiotics. What you need to do is figure out what might be going on, what organisms are the likely organisms, and which antibiotics cover them most safely and narrowly. So for that, you need the knowledge of which bacteria cause which infections at what site in the body, and which antibiotics cover them best and safest. Which is not all that hard. It's stuff that everybody should know by the time they're interns, certainly by second year, and you're working on your knowledge second and third year. The tendency toward broad spectrum coverage is a huge problem. But very often you're faced with a horribly sick patient, you don't know what's going on, and you have no choice in that situation. But we would love to have everybody think about what they're doing and choose the antibiotics appropriately. One of our biggest problems in antibiotics now is the fact that the clinical pharmacists are so good that the interns and residents have basically given way to the pharmacists, and they call them up and say, what should I do? They don't even call us, the ID people, to say, what should I do? And the pharmacists are great, but they're not doctors. They don't see patients and examine patients. They only work on the information you give them. So my least favorite answer when I ask one of the interns, why did you choose these antibiotics, is the pharmacist told me to put them on. No, I said, what are you trying to cover? Why did you choose these drugs? But people will not know how to choose drugs. They won't know how to dose vancomycin because the pharmacists always do this for us. That's going to be a real problem in the future, because clinical pharmacy is not just big at Brooklyn Hospital, it's caught on everywhere. And antimicrobial stewardship is mandated now by Joint Commission. So people are sort of saying, someone else's problem, I'll just do what they tell me. You got to keep trying to teach everybody.